CEN test prep exam difficulty. Question 1. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 2. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 3. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A hyphema involves: Option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 5. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 6. The initial fluid resuscitation bolus for a patient in septic shock, per Surviving Sepsis Campaign guidelines, is: Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 7. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: Option A, absent breath sounds. Option B, a dullness to percussion on the affected side. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. Question 8. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is: Option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Question 10. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A, TSI level 1. Option B, TSI level 2. Option C, TSI level 3. Option D, TSI level 4. The correct answer is option A, ESI level 1. Question 11. Fat embolism syndrome is most commonly associated with fractures of the: Option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Question 12. The priority patient for a trauma team activation based on mechanism of injury is option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Question 13. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 14. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 15. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval. Option B, peak T waves. Option C, ST depression. Option D, delta waves. The correct answer is option B, peak T waves. Question 16. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 17. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 18. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 20. In distributive shock, the primary pathophysiology is option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 21. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, hemorrhoids. Option D, Mallory-Weiss. The correct answer is option B, esophageal varices. Question 22. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 23. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer, option B, esophageal varices, option C, diverticulosis, option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 24. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours, option B, 4-6 hours, option C, 2-3 days, option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 25. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray, option B, abdominal ultrasound, option C, CT scan of the abdomen, option D, a complete blood count. The correct answer is option C, CT scan of the abdomen.